Hey everybody, today I'm going to be going over carpal tunnel syndrome. So, what exactly is it? So, typically, patients suffering from carpal tunnel syndrome are going to have pain, numbness, tingling, and that is resulting because of compression of the median nerve. So, exactly where that is happening is right here along the carpal tunnel. There's this carpal ligament that goes from side to side, and this area underneath it is called the carpal tunnel. So there's quite a few things that run through there. There's nine tendons. There's four tendons of the flexor digitorum profundus, four tendons of the flexor digitorum superficialis, and one for the flexor pollicis longus. In addition to those nine tendons, the median nerve also goes throughout there, and all of those are providing different functions to your digits. And the median nerve provides distribution to the thumb, index finger, middle finger, and then half of the ring finger. So for patients suffering from CTS, they're going to feel that numbness and tingling in those digits that I mentioned. Why does it occur? There's some pretty good theories. Genetic predisposition, also repetitive wrist movements such as typing, machine work, and then also if you have obesity, any autoimmune disorders such as rheumatoid arthritis. If you're pregnant, then it's going to be more likely that you'll suffer from carpal tunnel as well. All right. So, if you are doing an evaluation and your patient's complaining of night pain, numbness, tingling, I want you to think carpal tunnel. And then in your evaluation, there are some special tests that you can do to just further narrow it down. You can do Tunnel's, Phelan's, reverse Phelan's, and then also the carpal compression test. So Tunnel's, you're just going to kind of tap along that carpal tunnel and see if you can reproduce those symptoms. Phelan's, that is when you do a reverse prayer stretch, and you're going to hold this for 60 seconds. Again, if you reproduce the symptoms that they're feeling, that would be a positive test. And then there's reverse Phelan's, which is the opposite. It's just a prayer stretch. Yep, and you're going to make sure that this angle is going to be 90 degrees or as close to 90 as possible. And that just provides extra stress and compression to that median nerve. So if you're able to reproduce those symptoms within 60 seconds, it's going to be more likely that it is carpal tunnel. And then the last is the carpal compression test, which you're going to just add some pressure along the carpal tunnel for about 30 seconds. And if it reproduces symptoms within those 30 seconds, it would be a positive test. All right, so once you've narrowed it down and you're pretty sure it's carpal tunnel, or you have a diagnosis from the physician that it's carpal tunnel, how are you going to treat them? It's a great question. First thing, you're going to see what their daily life looks like, what they do for work, and see if there's any activities that they're doing that may be the culprit behind their carpal tunnel syndrome. For instance, if they are an accountant and they're on their computer 10 hours a day just typing, that could be very well the main cause behind their CTS. And with that, you'd want to modify modify the activity as best you can, so creating their better posture. And then also something that you could do is provide them an orthosis. And typically what I've seen is just kind of a wrist cock up. There's a good over-the-counter options, or you can make a custom orthosis for them. But essentially, you're just going to want to keep that wrist in neutral as much as possible, maybe slight flexion, just so you can alleviate that pressure along the median nerve. So having those orthoses on when they're typing, they'll be less likely to move into wrist flexion and type away and further cause that CTS. In addition, having those orthoses at night is going to be hugely beneficial because when we're going to sleep, we tend to go into a flex position, and that's just going to further cause those symptoms to be worse. So, yeah, make sure that they have an orthosis for night wear and that they wear it um, throughout the night, and then also throughout the day during any activities that may um, make that make those CTS symptoms worse. In addition, these are some other ideas of things that you could do during your treatment sessions: nerve glides, also soft tissue massage to the surrounding tissue of the carpal tunnel. You can do some desensitization techniques because I'm sure during the evaluation you'll do the Sims-Weinstein just to see what their sensation's looking like. It can be pretty impacted for more severe cases of carpal tunnel syndrome. And I should have mentioned this before. This is all conservative treatment of carpal tunnel syndrome. And again, other things that you could do if they have significant edema because of carpal tunnel, you'll want to manage that as well. So for therapy, we tend to treat them up to 4 to 6 weeks, depending on how much they need. And if the symptoms do not improve or worsen during conservative treatment, we'll refer the patient back to the physician for further evaluation. And it's possible that they'll just go ahead and get carpal tunnel surgery, where they kind of release that ligament and improve the pressure that's affecting that median nerve. It's a pretty simple and quick surgery, and the outcomes tend to be pretty good. But again, after surgery, if patients need hand therapy, just a quick referral and we'll take care of them. All right. Thanks, everyone. That's it for today in carpal tunnel. Bye.